Altruism in paramedicine, context matters. Altruism, the act of putting patient before practitioner interest. Compassion, an awareness of another's suffering coupled with a wish to ease that suffering. And caring, a prioritisation of patient interest, has been shown to improve patient experience. Acts of reasonable altruism, as discussed by Post, can improve the wellbeing, health, happiness and longevity of the practitioner. Given the positive impact that acts of altruism have on both patient and practitioner, it's vital that we review how paramedics in Australia are educated in the craft of paramedicine and the human interactions associated with acts of altruism, compassion and caring. The aim of this study was to determine the presence of words and themes within undergraduate paramedicine educational text, allowing the researcher to identify patterns in communication and determine the frequencies of selected words and concepts. Content analysis is an accessible, robust, qualitative research method used to identify and understand meaning in recorded communication. Klein-Hexel states that content analysis can be used to measure frequency of data and can also be used to delve deeper to understand, through provision of a structured approach, volumes of data. Students enrolled in the University of Tasmania Bachelor of Paramedicine are provided with educational materials in written form via an online platform that we know as My Learning Online, Milo. Each of the 24 units within the degree have an associated Milo page with key materials provided by the lecturer of the unit. A content analysis of online written educational materials was conducted using words associated with altruism, compassion and caring as identified by a prior scoping review entitled Altruism in Paramedicine. Please see Figure 1 on the poster for the word search list. The word list included variations in spelling or word form, for example care and caring, where applicable. The content analysis included units coordinated by the School of Paramedicine and related to clinical practice, that's where patient engagement is expected and explored. A total of 11 units were included in the content analysis. The words with the highest and lowest frequencies are presented in Figure 2 on the poster. Also included in Figure 2 are the search words that were not found, and this includes altruism. The list of identified words was then reviewed for use and categorised in Max QDA with the aim of identifying word context and associated meaning. The results suggest that many words associated with altruism, compassion and caring can be used multiple ways or are subject to variations in interpretation. The most frequently used word, care or caring, was used 947 times with 7 different categories, including as a quantifier, like reasonable care, excellent care, to explain caring or looking after, such as self-care abilities, demonstrate care and concern. It was used to explain looking after non-human items, for example, lawn care. The word care was also used to describe the place or the system providing a care or care plan, like intensive care, point of care, healthcare provided. The word care was used to describe those providing care, for example, caregiver. Patient care was also presented from a clinical perspective, such as airway care, wound care and post-arrest care. And finally, the word care was used in relationship to a qualification, intensive care, critical care. On occasion, the word care could be categorised with more than one meaning. For example, providing astute and compassionate clinical care during emergency situations, which includes the categories of caring for and clinical care. In some instances, the grouping of search words form part of a more general description. For example, this is about the important combination of being an authentic, professional, listening paramedic who demonstrates that they understand the gravity of loss through quiet and empathetic interactions. This sentence includes search words authentic, professional and empathetic. None of the search words were defined in the context of paramedicine, nor were variations of meanings presented to students. Paramedicine academics use the words in different ways, and at times it was difficult for the researcher, me, to be sure of the writer's intended meaning. The essential premise of educational materials can be understood or misunderstood by the learner depending on word choice, sentence construction, and an individual's understanding of the word itself. The provision of a simple course glossary is suggested. In paramedicine education, the writer's word selection, definition, or concept may differ from the reader's interpretation of that same word or concept. Context is important, and the educator should clarify the meaning and context of words used within a unit. Likewise, those with oversight of courses could provide a glossary and examples of words used for the benefit of the student and lecturers alike. Future patients will be best served by an undergraduate paramedicine curricula that is well-rounded and inclusive of the facets of altruism, compassion and care. As such, it's important to provide clarity in the context of undergraduate education of paramedics.